in the community are being recruited. So here we had an issue of low staffing for environmental staff, but most of these were recruited and next lecture. Then we also had issues of open defecation, and if I may remember, this was Katwe, and it was handled, and we expect improvement in our latrine coverage and the outcomes at health facilities. Then engagement of the political sector, law enforcement, and community involvement in implementing the Public Health Act. This is still under environmental, and it is still ongoing. The environmental department is handling this. I think we have part of those staff with us here, the HSD heads for environmental. Then review data at facility level and engage the sub-county for implementation. So it was a proposed solution that health facilities, when we are holding this as an annual performance, what about us when we go back? Do we also review? Next. Okay, so this is about the emergency services. The district has developed a plan. So it was about the high costs of the ambulances, which was delaying maternal cases. The district has developed a plan for subsidizing the ambulances by creating a pool for support, so that when there is any maternal referral, it does not need bureaucracies. So I think this one was done by our DHO, and we shall soon realize the benefits. Next. Integration. We had a low coverage of viral load for Kilembe Mines Hospital, Ihandiro, Karibu, Chinyamaseke, Mahango, Railway, and St. Paul's Hospital, and this was attributed to poor documentation. So the proposed action was to follow up on these facilities to understand what is the problem. So a number of them have been followed up, and UPMB is proposing to again come and support us so that we engage on the facilities. Then this one requires warehouse hospital, mixture of patients, psychiatric patients with general patients on ward. This one we didn't get feedback from warehouse hospital. Do we have
I know it's still the same, sir. The last time we visited warehouse hospital with the PS, one of the biggest challenges was they did not have adequate space for the wards, and one of our biggest recommendations was where for another separate infectious patients from the chronic ones, and then this kind of this is still the same, because we know that where the situation they still mix infectious, the psychiatric, because of lack of space, and we are supposed to be pursuing this at ministry level to see if they can get another ward. That was the recommendation of the PS when she came here last time.
Okay, thank you, doctor. So Bora Hospital, you will go on lobbying for funds to ensure that our patients are kept accordingly. Then from the partners, we have the Kamuri model. This one is being implemented. We have talked about it. Global health security. We had an issue in Kaendoro. Diversion of care by church in Kaendoro. So we are supposed to visit this church and educate them. and we seem not to have captured it well, but we shall get feedback before we leave here. Then, next. This was about supporting HIV activities in the district for the 31 facilities, support the safe spacing for providing HIV services in Hima, Mbondwe. This one is still all about integration. Next, which should be the last. I think what we didn't capture here was about the eye services in the district. The complaint was the services are being done in the district, but it is not felt in the district. So the question is why? So we had a meeting with the partners, and we made some actions against this, and I think that one was covered. We shall we shall see that during the presentation, and we thank you for listening. That is all that we discussed in the last performance review. Any question will be maybe raised during the discussions so that we update. Thank you for listening.
Thank you so much, Nelson, for taking us through the previous action plan. And I think the members who are in that meeting welcome the other participants that have joined us, but in a special way welcome the Chief Administrative Officer who has joined us, and also the senior planner has also joined us from the district, and other partners, Baylor, reach a hand. But for the benefit, I would like to take ourselves back to the objectives for this meeting. And I also want to mention that for the purpose and benefit of our colleagues who have not been able to join us, we have what we call an online streaming. So the guy before us is capturing us online. We are going to share a link on our WhatsApp group so that that is what is happening. So this meeting, the purpose of this meeting is to strengthen healthcare service delivery through holding regular performance review meetings. And in this, we want to assess the progress in healthcare service 2026. To that, we want to enhance our coordination and collaboration amongst the stakeholders that we work with as we offer health the first 6 months of this financial year, but also capture the challenges or the gaps that we will have faced as a team. We will come up with practical recommendations to improve healthcare service delivery. We have seen that we have been making generic action points every time, and we are not seeing changes in some of the indicators, yet we have action to them. At the end of the day, we need to see a strong engagement with our stakeholders in addressing the key health challenges that we experience as Kasese district. So having taken you through the objectives of this meeting, and I don't know if it is, allow me to invite the DHO, to invite the cow to come and give his remarks to this meeting. Thank you.
Thank you once again for listening to the speaker, and allow me to also take the opportunity to welcome those that have added on us since we began. I realize a few of you that have just joined us after we started, and important amongst whom the Chief Administrative Officer joined us, and I want to take this singular moment to really welcome him to speak to us shortly after he finishes writing. Of course, in addition to the Chief Administrative Officer, I also saw the arrival of the RDC, who is present amongst us, seated with the Chairperson Nelson 5, and I'm sure at an appropriate time, the RDC will also have some remarks. According to this program, is supposed to come shortly after cow. But I don't know whichever style he can use. There are those that think they should speak after listening to the presentations, but for purposes of speaking now, RDC, we thought you can have a few remarks at the beginning, but if you choose to speak later, I don't know, whatever you choose. But for now, allow me to invite the Chief Administrative Officer to give us a few remarks, and thereafter the RDC will follow to make an official opening, and then we can proceed. Thank you, Cow, for coming and taking up the front to speak to us. And the network work where he is. All of them.
I'm sorry I'm not well acquainted with this white man's technology, but I will try my level best. The resident district commissioner present, the district chairperson, development partners present, the district health officer and your team, colleagues with whom I have come, in charges of health facilities, all invited guests, ladies and gentlemen, good morning to you. For the consumption of those who have not yet grasped my big names, Eliab Ntarwete Begumia is my name. If everything confuses you, you capture one, the smallest. Eliab is okay. However, when it comes to legal matters, I cannot accept being identified by that name, because I even don't know its story. But Begumia Ntarwete binds me legally. One, I wish to first of all begin by apologizing to you, DHO, for having come in a little bit late. I would have loved to begin with you. I would have loved to stay with you the whole day. I would have loved to continue with you the second day, but I hope the nature of my work cannot allow me to do that. I will only utilize a few minutes with you and go away, but I will stay with you in spirit. Two, I wish to commend you and your team for the great services you are rendering to the people of Kasese. I'm really very, very, very happy. If you don't want to clap for yourselves, that's your own challenge. But deep in my heart, if I was to get your hands, I would clap louder than that. Kasese, in my own understanding, should never by any standard be compared to other small districts of this country. People look at it differently from those who stay in it. Even myself, when I came here, I was very much impressed by the tarmac road and the good buildings around here, well knowing that Kasese is like that. I only knew Kasese when I started going to Kasese. When I visited areas of Wensungu, Chitolu, Mahango, where I said, oh, so this is Kasese. I made my colleagues laugh a bit. My first time to go to Mahango, I started the journey very well with a lot of excitement in a very strong double cabin pickup from education department. As I started climbing the hill, I kept quiet until when I reached Mahango. And when I reached Mahango, I was now praying to God, will I find my way down? Again, when we started the journey down, I also kept quiet until I reached the tarmac road. From that very day, I thank the driver for education. He has remained my best friend to date. I always call him my buddy. I never thought that I would go to Mahango and come back. Now, if I go back to put myself in the shoes of those civil servants who make it on a daily basis for an RDC, go to Mahango and come back with that kind of risk that I saw, why not say that I'm happy with them? I know you have a lot of challenges you are going through. Despite all of those criticisms that are coming on board, you are able to go there and give services to the people of Uganda. That's the reason why I was saying I'm happy with you, and I was saying we clap for ourselves. I'm also happy with you for having organized this performance review meeting together with our development partners. I have served in many districts in this country. I've traversed this country both in north, south, east, and west, and parts of central. Kasese seems to be the only district with very big numbers of development partners. Yes. You try other districts, you'll come back and tell me the story. But at times, I wonder, when I go on the ground, I ask myself, where are they? What do they do, apart from a few that are visible? So when we are in this performance review meeting, let us do the review from the practical part of it, but not from the academic part of it. When you come here and do these thematics, you present the good tables, you put there the good white man's language, and I don't relate it with what is on ground, I don't feel happy. So assessment of performance should address itself to the practical realities on the ground than the academic part of it. It's always good to have flowery and good looking reports. But on ground, if we cannot see the reports translated into the practical realities on ground, then there is a missing link. Now, I wanted to look at performance in a very simple perspective. Look at, how many of you are well acquainted with ROM, results-oriented management? Many people tend to forget ROM. ROM will be with you until you leave this world. Anything you do, you expect results. But what matters is how you start it, how you go about it, whom you do it with, what process you go through until when you deliver. So in between, you'll find that the end product has not come by you alone. It has come by the help and assistance of others. That's why for us in management, we say that management is all about getting things done with and through others. Yes, you are the in charge. Are you the one producing those results for your facility? Are you the one? But when things go right, whom do we thank? The in charge, the commander. But the commander must get things done with and through others. So when you are assessing performance, beginning from the word go, what is it that is the task you are going to play? What do you require to make it get started and get concluded? Who are those actors and actresses? What are the other resources? Which processes are needed? At the end of the day, what am I targeting? How will I achieve that target? What have I produced vis-a-vis what I targeted? And after producing it, what is the effect? Don't stop at the outcome, at the output. Also look at the outcome, the effect. The effect. So, DHO and you colleagues, in performing your duties, in reviewing your performance, begin by looking at the inputs. Inputs are many, including the resources that we use, both time, money, and others, even the human resource itself, because you put there the brains, and then continue to look at the processes, look at the targets, look at the indicators, look at the outputs, means of verification. If I am to come and see whether you have attained what you are telling me, what do I have to look at? For example, if you say this one was achieved, this one was achieved, the meeting was successful. Now if I'm to go back on my monitoring visit, there must be something that I have to look at in order to prove that really it was attained or not. If health service delivery has improved in Kasese, may need to look at simple things. Disease prevalence must be subsiding. Maternal and whatever death rates must be. Immunization rates going high. People attending antenatals and so forth going high. Then I say, yes, there is improvement in service delivery. But if they are still not going there, then there is a missing link. Could it be that we are not giving them adequate attention? Could it be that they are not aware? Could it be that when they come there, what to tell them and what to give them is not there? All those are issues to look at. Now, in reviewing performance, the critical factor is the human resource. Gentlemen and ladies, we might be here talking about results, good performance, and so forth. What is behind that is the human resource itself. Quite often than not, we get information coming to our offices. Juniors complaining, others fear even to come and put it explicitly in black and white. We no longer go for outreaches. The in-charge is the only one who goes for outreaches and so forth. But say, would you be bold enough to scribble something for me? No, I think they will use it again. No, a whistleblower can be